Hello everyone, this is Chadi Alraies from CVI 2022. I'm really privileged to be with Dr. Khaldoon Alaswad. He's Cath Lab Director at Henry Ford in Detroit. Dr. Alaswad, thanks for being with us.
Thanks for inviting me.
Yeah, you are a CTO operator as well as complex intervention operator, and you did a phenomenal job yesterday moderating and seeing a lot of cases of calcification. So what is the state of the art now for approach and management of heavy calcified lesions?
Well, thank you for this question. It's amazing. Yesterday, the session started about calcium. It turned out about imaging. So what we found out from all the speakers that calcium is underestimated and you need imaging to find it. And the management of calcium throughout the procedure also need imaging. So the state of the art nowadays is we have 3 devices, fortunately, in the market. We have orbital atherectomy, rotation atherectomy, and we have the shockwave. And of course, we have the good old balloon, non-compliant balloon. The common theme was you need to be very thoughtful and purposeful about how you use these devices during the procedure. And your procedure need to be imaging guided, whether use IVUS or use OCT. And fortunately, there are criteria for both now, how to assess the calcium extension and severity, and actually how to assess your procedure outcome. And basically,
The imaging also will dictate your approach to that lesion.
Absolutely.
From the tools you mentioned.
Absolutely. So the imaging, probably, I'm not sure imaging at this stage helps you pick which device to use, but will tell you need to use a device. But what imaging does probably predict your long-term outcome, like MSA, minimum stent area. There is criteria by IVUS. You have to achieve 5.5, by OCT 4.5. So if you achieve that by IVUS or OCT, you know like your job is done there. What we're waiting for is actually for the refinement of all these techniques and the results of the alumni clinical trials and all these other trials to be able to kind of help us dictate and pick which device to use in which patient and which calcium syndrome.
And definitely these lesions are opt for complications. And also you are moderating as well, chairing a session for complication.
That's true.
So why is it important to learn about complication?
So complication is the stepchild of the cath lab. Unfortunately, fellows do not learn because fortunately, not so many of them happens during the 1-year training. Unfortunately, you have to kind of train by fire how to manage complications. So, but they do occur in the cath lab, and they are all the way from 1% to 5%, and it depends on the complexity of the lesions you treat and tackle in the cath lab. So the session today, we talked about perforations and how to manage them. Dr. Gulati did a great job describing how to manage a large vessel rupture. We added how to manage the distal vessel perforation when you actually perforate a branch. Fortunately now, the literature is full of algorithms, how to manage complications. There are a lot of other complications still kind of difficult to manage, like no reflow. Still the pain in the side of every interventional cardiologist. When it happens, it's associated with increased risk of mortality, other complications, and the treatment of that still kind of haphazard. So I think consensus and knowledge exchange between interventional cardiologists is the most important thing to manage complication. And the reason is the following. We really cannot run trials on how to manage complications. An incidence is 1 to 2%, and you have to consent every patient. For example, now we are part of the study to evaluate the ringer balloon, which is a balloon that actually, a perfusion balloon that stops the bleeding in the large vessel perforation, but provide flow. So it took us 6 months to get community consent to be able to enroll patients. And how we're going to do that for every device, for everything.
Yeah.
But the common theme, I was just going to leave the audience with this message. you really need to learn how to manage complication, even if you've never seen them. And it's easy. Manage how to use coils. You need to go watch videos, ask expert, but you also can ask industry to train you how to use the coils.
Right.
And similar, you need to have covered stent, and you need to know their characteristics and how they perform and how to deploy them and how to deliver them. And other complications, you basically need to pay great attention to them and learn from others, hopefully not from your own mistakes.
Exactly, yeah. That's why it's important to come to these sessions to at least give
Absolutely.
you like a biopsy of complications.
Yes.
Dr. Alaswad, thanks so much for your thoughts on the calcification as well as complication. Please watch these videos and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. Dr. Alaswad, thanks again.
Thank you so much. All right.